My name is McKenna Crittenden, and today I will be discussing postpartum depression across different cultures. In today's discussion, we will talk about what is postpartum depression, traditional practices, treatment, risk factors, and postpartum depression in immigrant women. How do you define postpartum depression? Our textbook defines postpartum depression as feelings of sadness and anxiety so intense as to interfere with the ability to carry out simple daily tasks. Postpartum depression occurs in parents with a newborn baby. Worldwide, 80% of postpartum cases are undiagnosed and untreated. Traditional practices. Ethno-kinship cultures. These are cultures that focus immediately on the social support of the mother from the family. The care can last several weeks and includes periods of social isolation, mandatory rest, and emotional and physical support. The goal of this is to provide a smoother transition into motherhood by reducing mental tension. Ethno-kinship cultures include Eastern Asia, South Asia, Africa, Eastern Europe, and the Middle East. Technocentric cultures. These are cultures that focus on the care of the infant before the care of the mother. Postnatal care practices last around 24 to 48 hours. The mother is cared for through technological mechanisms. Once the mother leaves the hospital, she is responsible for herself and her baby without complete social, family, and emotional support. Technocentric cultures include the United States, Canada, Western Europe, Great Britain, New Zealand, and Australia. Examples of postpartum treatment across Asia. Postpartum depression is prevalent in 12.7 to 17.3% of women in China. In China, the traditional practices and treatment after giving birth is that the woman's mother and mother-in-law take care of the baby. Postpartum depression is prevalent in 33% of women in Vietnam. A male baby raises the family social status, and negative emotions are not allowed to be expressed. 5 to 27% of women suffer from postpartum depression in Japan. The woman returns to her family, which would be her mother and her grandmother, during pregnancy. The women of the family take care of and prepare her for childbirth. 11 to 32.4% of women suffer from postpartum depression in India. The woman often faces criticism if she gives birth to a girl, and it is believed that the mother should always look joyful, cheerful, and happy to bring good luck to her baby. Examples of postpartum treatment across Africa. 3.7 to 20.9% of women in Nigeria experience postpartum depression. Pregnancy is guided by the female family members, and the birth of a boy is regarded as a victory. She is given the best food for a month and is isolated for 2 to 3 months. 17.9% of women experience postpartum depression in Egypt. The birth of a female child may lead to divorce. The woman experiences extreme criticism and resentment if she does give birth to a daughter. The woman experiences a period of isolation and relaxation where female family members take care of the household, and she must avoid cold foods. 10 to 43% of women suffer from postpartum depression in Uganda. The husband decides where the woman will give birth, and most of the births in Uganda are traditional home births. And the woman must face isolation for 3 months with disregard to her mental health. And 34.7 to 48% of women in South Africa suffer from postpartum depression. It is believed that the thoughts of the mother affect her labor and her child. The mother is expected to continue working without complaining, and she will give birth alone outside of the community. Postpartum depression in North America, the United States. Women in the United States tend to minimize their symptoms to avoid the stigma that is associated with mental illness. Caucasian women have the lowest risk for postpartum depression. Asian American women have the highest risk for postpartum depression. Hispanic women explain postpartum depression as feeling anxious without a specific reason, and African American women tend to turn to loved ones and religion to cope with postpartum depression. In Canada, postpartum depression shows low prevalence. However, Canadian mothers normalize their symptoms to avoid being viewed poorly, as they don't want their loved ones to know that they feel ashamed and embarrassed of struggling with depression, and this will cause some to have suicidal tendencies. Risk factors. Predisposing factors. So these are things that could increase your risk of having postpartum depression. These are absence of postnatal social support, personal history of mental illness, low income and financial difficulties, free marital status, prenatal mood disorders, unwanted or unplanned pregnancy, poor marital and intrafamilial relationships, premature birth, low self-esteem, poor conditions of living, unemployment, stressful life events, low education, low socioeconomic status, and family history of alcoholism. Cultural factors. Other risk factors of postpartum depression for women in non-Western countries include the birth of a female child in cultures that prefer male children, gender-based violence, and violence and hostility within family. Postpartum depression in immigrant women. Migration. Many immigrant women living in Western worlds often experience the feelings of isolation and feeling alone as they are separated from their family and loved ones. This causes strains on relationships as they expect their husbands or significant others to be there for them. Other things are cultural influences, such as adhering to gender roles, childbirth practices, and beliefs such as religion. Childbirth practices include what we discussed earlier in ethno-kinship cultures, which are not widely as accepted in Western cultures. And other issues are language barriers and healthcare barriers of immigrant women not knowing of the healthcare resources that are available to them. Conclusion. So in conclusion, postpartum depression is a disease that is prevalent in all cultures and countries. While the treatment of postpartum depression varies throughout the world, it is a serious issue that needs to be addressed. Women struggling with postpartum depression should be treated with care and have their feelings validated. They should not have to face the judgment of seeking help for mental health issues. And here are my references. I used Cross-Cultural Approach of Postpartum Depression, Manifestation, Practices Applied, Risk Factors, and Therapeutic Interventions. I also used The Experience of Postnatal Depression in Immigrant Mothers Living in Western Countries, a Metasynthesis, and I also used our textbook. Thank you!